Dr. Shafique Pirani, a friend, has inspired the East African Asian diaspora, then the Canadian community, and people around the world. Dr. Shafique Pirani has an orthopaedics practice at the Royal Columbian Hospital. His area of interest is in pediatric orthopaedics, with an emphasis on clubfoot, pediatric hip abnormalities, and, oh my God, I can't say this. What's this? Ilzarov method. Is that right? Method of treating musculoskeletal disorders. He is the principal investigator and driving force of the 1.8 million Ugandan Sustainable Clubfoot Project, USCCP, funded by the Canadian International Development Agency, CIDA, and Enable Canada. The goal of this project is to reduce the consequences of disability from neglect clubfoot in Uganda through a public health approach. This is by making available sustainable, universal, effective, efficient, and safe treatment of the congenital clubfoot deformity. Ponseti method. Shafique Pirani.
Thank you so much, Umida, and thank you, Joanna, and for this invitation. I should start with a story, my story really. I was born in Uganda, but I left at age 15 at the invitation of Idi Amin, along with 80,000 others. I trained in Canada, became a pediatric orthopedic surgeon or children's orthopedic surgeon, and then went back to Uganda after 26 years away to see the old house and the school. But on my arrival there, I started to understand the problem of clubfoot in the Ugandan context. And you'll see perhaps another picture. It's a birth defect where children are born with their feet turned backwards, about one baby in 1,000. And that's my specialty here. And if you're born in Uganda with that condition, which at the time was surgically managed, the chances of you getting a treatment for it were very little, because the access to surgery is very hard in developing countries. At the time, I had become a student in this method of manipulation and casting by the Ponseti method that you see on the picture. The results were very good, and it came to me that perhaps this would be a good way to manage clubfoot in Uganda, and not by doctors, but by paramedicals. And the materials are such that these things are easily available in Uganda. And what we tried to do was to come up with a method of treating this deformity in an economically and socially feasible way for Ugandan society. So we went back, initially sponsored by Rotary, to see if this method would work. And our pilot studies showed that it would work in the hands of Ugandans, paramedicals. And then we went back with the assistance of the Canadian International Development Agency. We've been there 6 years now, building capacity throughout Uganda for the management of clubfoot. And our experience was interesting, because the first time around, it was much more in the way, as Jerry would say, for rather than with. And the second time around, we went back as with rather than for. And we're now coming up to the end of a 6-year work, and what we've managed to do in terms of capacity building is build capacity within the healthcare system for the management of this condition, and also build capacity in the educational system for teaching how to treat this condition. The net effect, the net impact, is that a child born in Uganda hopefully will have a much better chance of not growing up with this deformity, being able to get married, being able to go to school and have a job, and returning children born with clubfoot back to their normal life trajectory. Thank you.